The hearing will come to order. Without objection, the chair is authorized to declare a recess at any time. This afternoon's hearing of the Oversight and Investigations Subcommittee is entitled Preventing Harm to Veterans, Examining VA's Overpayments and Debt Collection Practices. The Department of Veterans Affairs provides an array of important benefits to millions of veterans who have valiantly served our country. At times, the department makes overpayments in administering these programs. Unfortunately, this subcommittee has heard of too many cases in which VA's efforts to recover overpayments result in confusion, frustration, and significant financial hardship for veterans. And VA makes a lot of overpayments. In some cases, overpayments have accumulated over years and can total thousands of dollars for individuals. The VA overpayments regularly create debts in excess of $2,500. For example, the department has over 150,000 cases of such debts in its disability compensation program alone. In fiscal year 2018, VA's Debt Management Center sent out over 600,000 debt notices for veteran benefits overpayments alone. These notices relate to $1.6 billion of overpayments that VA is attempting to recover. Let me repeat that, $1.6 billion in a single year. These numbers clearly show that VA has a lot of work ahead to reduce the number of overpayments sent to veterans. Of course, receiving a notice of payment due can prove particularly burdensome for veterans on fixed incomes, recovering from a disability, or for those who are supporting families. For almost all veterans, receiving a surprise letter saying thousands of dollars are due in 30 days will be quite a shock to them. Working through a confusing bureaucracy to figure out why and how to make repayments is just frustrating, and it's also a major challenge for anyone who's trying to make ends meet. The causes of VA's overpayments are many. Life events such as the death or divorce of a spouse can affect a veteran's benefit. If the veteran's account is not updated accordingly, for instance, if VA doesn't process the change on a timely basis, an overpayment will be made each month until the record is updated. That's right. VA's own internal delays or mistakes can cause overpayments to veterans and trigger collections. When VA identifies an overpayment, its Debt Management Center is responsible for working with veterans and other beneficiaries to recover funds. However, two other parts of the VA, the Veterans Benefits Administration and the Veterans Health Administration, also play a direct role in identifying and notifying veterans about overpayments and debts. As with many issues that the department faces, the siloed nature of VA is a challenge in this instance. Unfortunately for many veterans, debt collection doesn't stop with the VA. The department will ultimately transfer overpayments that it has not recovered to the Department of the Treasury, which may pursue more aggressive collection methods and charge interest and fees on top of that debt. All of these many steps and the number of players both in and outside the VA show why communication with veterans needs to be clear and effective. Yet veterans who have been overpaid will generally receive letters from multiple VA offices. These letters are often confusing, and none of these letters give a complete explanation as to why the overpayment occurred and what the veteran can do about it. I've heard this message loud and clear from my own veteran constituents, and my fellow subcommittee members have heard the same. Veterans themselves must piece together the full picture. Veteran service organizations offer free support and help to veterans who receive overpayment notices from VA, but even with this support, it can be difficult to navigate the VA's debt collection processes. I look forward to hearing from many of these organizations and advocates during the second panel of this afternoon's hearing. One point I want to explore is the department's requirement in law to waive recovery of overpayments if the collection would be against, quote, equity and good conscience. Obviously, if the collection of an overpayment would bring harm to a veteran on a fixed income receiving disability payments, something's wrong. The law was intended to ensure that collections only happen in an appropriate manner. However, as we will hear, there are many cases where the VA falls short of this goal. Of course, I think we can all agree that the fewer veterans that face collection from the department, the better. But even with efforts that are underway, the level of overpayment that VA makes and then attempts to recover from veterans continues to be staggering. I look forward to a constructive discussion on the steps the department will take to stop these overpayments in the first place, ensuring that no veterans are harmed by confusing collection processes. With that, I would like to recognize our ranking member, General Bergman, for 5 minutes for any opening remarks he may wish to make.
Thank you, Mr. Chairman, and thank you for holding another hearing on this very important topic. Mr. Chairman, I do not need to tell you the dramatic impact debt can have on an individual. As a military commander, I saw troops who were ineligible to deploy because they were deeply in debt. An unexpected trip to the doctor or an emergency car repair can be very stressful for many families. Financial problems can also lead to professional problems and increase a person's risk of suicide. To that point, Mr. Chairman, in particularly since September is National Suicide Prevention Month, I want to note that I've, along with Chrissy Houlihan, introduced H.R. 3495, the IMPROVE Act, that would expand the Department of Veterans Affairs suicide prevention programs by supporting entities that provide and coordinate suicide prevention services for veterans and their families. I appreciate you co-sponsoring the bill with me and hope that this committee can consider it as soon as possible. Today, however, we are here to talk about veteran debt that is owed to the VA, the agency's methods for collecting on the debt, and the impact of VA's collection efforts have on veterans. This is not a new issue for the committee. As the chair of this subcommittee the last Congress, I held an oversight hearing in May of 2017 to review the VA's financial management program, including VA's debt collection practices. In addition, Representative Bost, former chair and current ranking member of the Subcommittee on Disability Assistance and Memorial Affairs, also held a hearing last Congress to examine how the Veterans Benefits Administration could effectively prevent and manage overpayments. I sat on Mr. Bost's subcommittee last Congress, and what I learned was that VBA creates benefit debt in excess of $1 billion a year, much of which is traceable to benefits processing errors or failure to process changes such as a dependency change in a timely manner. When processing delays result in a veteran being overpaid, VA creates a debt to recover the overpayment. Ensuring the dependency changes are processed appropriately and quickly seems like a straightforward way to avoid creating debt. However, when I asked the VA if they had a plan to get better, the response was that they were trying. Well, trying is not good enough. I hope to hear VA has taken ownership of this issue and can point to concrete steps that it has implemented to reduce avoidable benefit-related debt. It is important to recognize that not all veteran debt is due to VA processing errors. For example, medical debt owed by veterans is often debt created to collect copays from higher priority group veterans who receive medical care and prescriptions for non-service connected conditions. VA is also authorized to recover costs for treatment and prescriptions from third-party insurers related to a non-service connected medical condition. In fact, VA anticipates recovering $3.9 billion in fiscal year 2020. Third-party debt collected by VA stays with VA and is used to provide medical care and services. I assume we agree that VA should continue to aggressively collecting the third-party debt. Mr. Richalski, as the Assistant Secretary for Management and Chief Financial Officer, you oversee the Department's finances, including its debt collection activities. It seems that you've made honest efforts to address the underlying problems, making this process so onerous and burdensome for all parties involved. For example, I understand the VA is working on fixing the IT issues that prevent a myriad of VA legacy IT systems from communicating basic data with each other, such as changes to dependency, information, or benefit eligibility adjustments, both of which could alter the amount of compensation the beneficiary is entitled to and result in overpayment and subsequently debt. Mr. Richalski, I recognize that your staff is put in a difficult place every day. They are charged with striking a balance between making compassionate consideration of a veteran's financial circumstances and a policy requirement for aggressive collection of debt owed to VA. I look forward to hearing how VA balances those interests. I also look forward to hearing the efforts your office has taken to identify trends in creation of veteran debt and to explore the strategies in place to reduce the amount of veteran debt that is the result of errors or untimely processing of claims. Finally, I appreciate the expertise of our VSO partners. The frontline perspective they bring to this discussion, gleaned through decades of service to veterans and their families, is invaluable, and I thank them all for their candid testimony. With that, Mr. Chairman, I yield back.
Thank you. I'll now recognize our first panel. This afternoon, we have Mr. John Richalski, Assistant Secretary for Management and Chief Financial Officer of the Department of Veterans Affairs. Mr. Richalski has served in this role since December of 2017. Accompanying him this afternoon will be 3 additional representatives from offices across the department. First, we have Mr. Joseph Schmidt, Director of the department's Debt Management Center. We also have Mr. Charles Tapp, Chief Financial Officer of the Veterans Benefits Administration. We also have Ms. Susan Reed, Executive Director of Revenue Operations in the Office of Community Care at the Veterans Health Administration. Mr. Rochalski will provide testimony for the department, and all of the VA witnesses will respond to questions. The subcommittee thanks you for appearing today, Mr. Rochalski, and you have 5 minutes for your opening comments.
Thank you very much. Chairman Pappas, Ranking Member Bergman, distinguished members of the subcommittee, thank you for the opportunity to discuss VA's overpayments and collection processes. Because you've introduced us and my colleagues, I will not go through a second round of introductions. I'll get right into my testimony. Overpayments or debt can have a devastating impact on the lives of veterans, and this can be exacerbated by poor management practices that work against rather than for the veteran. For my oral statement, I'm going to give you my candid assessment of where we are with debt management, the good and the bad, and what you can expect in the future. My assessment is that the VA's debt management structure and processes evolved over many years in a fragmented manner that was designed for VA convenience and to comport with antiquated VA systems, as opposed to minimizing the negative impact on veterans. At times, debt workload has been set aside while resources were redeployed to higher priorities, like processing original claims for compensation and pension. No one disagrees that legitimate overpayments must be collected, but the mechanics of how that happens make all the difference, and we are too often fragmented, uncoordinated, and highly variable in our processes. Frankly, we have a way to go before we can declare success. Fortunately, we have a highly motivated secretary who has made customer service a top priority, so I have the mandate. First, I want to highlight where I see our greatest deficiencies. Debt management is still very fragmented by administration and even within the administrations. Veterans cannot get one-side picture of their debt, and they still receive multiple communications. Too clunky and too confusing. Despite computer matching agreements, we are not anywhere near preventing veteran debt. Processing time lags exacerbate the situation. Our mission must be to prevent debt creation. We don't have robust online customer relationship management capabilities. We have some, but nothing close to the extent that we need. Acknowledging our frailties, I'd like to highlight where we've made progress, and I believe that we have made some good progress. First, VBA has used the national work queue and establishment of non-rating resource teams to dramatically reduce and manage debt-related workload inventory. The Office of Community Care now has special programs to help high-risk veterans who may be struggling to pay VA medical copayments. They work with facility suicide prevention coordinators to offer high-risk veterans financial assistance that best meets their needs. We're using computer matching agreements more effectively, like Social Security death matches weekly, and taking steps to increase DoD data feeds for reserve duty drill pay from annually to monthly by mid-2020. We prospectively notify veterans from these matches to let them know there is a potential overpayment, and we take action as soon as possible to minimize the size of the overpayment. We've made notable progress on an electronic solution for dependency changes. Veterans changed their dependency over 400,000 times in fiscal year 2019, and about 80%, or 320,000 transactions, were completed via an electronic means that resulted in an immediate system update. We worked with industry professionals to overhaul a number of debt notification letters so they are more user-friendly and easy to understand, and we are in the process of working with VSOs and others to rewrite even more. The Debt Management Center instituted important changes, like automatically defaulting to a 12-month repayment plan for compensation and pension debts, including drill pay-related debts, rather than the previous practice of offsetting all overpayment as soon as possible. The response from affected veterans has been overwhelmingly positive and appreciative. Most importantly, we are capitalizing on the Secretary's customer service priority and have partnered with the Veterans Experience Office to dramatically improve customer service through their many training initiatives, including Own the Moment and Veterans Journey Maps. Going forward, here's what I would like to accomplish in the next year. First, have the capability for veterans to view debt online. We expect medical debt to be available in the next 3 to 4 months, and compensation, pension, and education debt sometime in mid-2020. This is still not where I'd like to be with everything in one place, but it's a big step in that direction. I would like to consolidate and standardize debt management and notification processes within each administration to decrease the amount of letters and reduce confusion. I would like to continue to reduce the inventory of debt-related workload and greatly reduce the processing time for actions like waivers. I would like to increase our utilization of our Veterans Experience Office and VSOs to improve the effectiveness of our engagement with veterans. Within the next 3 years, I would like to consolidate all debt into a single portal, giving the veteran the ability to see all debt in one location to make payments and communicate with VA staff regarding the debt. I would like to have a single coordinated point of issuance for all debt letters and all electronic debt notifications. And finally, I would like to better leverage computer matching agreements and identify new data sources and methods to prevent the creation of debt. I look forward to working together and appreciate your continued collaboration and support of the Department. There is significant work ahead of us, and we look forward to working with you as we improve our service to America's veterans. Thank you. We're now ready to take your questions.
Well, thank you very much, Mr. Rochalski, for that statement. I know members have questions, but I'd ask the unanimous consent of the subcommittee to recognize Ms. Rice for a few minutes to make an opening statement and take that out of order. Seeing no objection, Ms. Rice, you're recognized.
Mr. Chairman and Mr. Ranking Member, thank you very much for this courtesy. It's concerning to me that a number of the overpayment debt collection cases that I've seen in my district have involved elderly veterans. Just going to give you the example of one pretty stark example. We had the daughter of one of my constituents reach out to my office for assistance on behalf of her father, who was a 94-year-old veteran. He was informed that he owed VA thousands of dollars for overpayments. This gentleman was on a fixed income and relied upon his VA benefits, so this created a real threat of financial hardship for him at obviously a very vulnerable age. In 2011, his wife had passed away, and he informed the VA at that time about the death of his dependent, so his benefits would be adjusted. It was not until 7 years later, 2018, that he received a letter from the VA notifying him that the VA had made the dependency change then, and that his benefits would be decreased to retroactively account for that entire time period. Even though the veteran had informed the VA of his dependent's death and 7 years had passed before VA actually processed that change, he and his family are now burdened with this debt. Now, in addition to the processing delay, the information provided to the veteran and my office once we got involved was incredibly limited and confusing. There was no explanation for how the VA had determined the total amount that he owed, and the veteran's request for a waiver was denied because it hadn't been submitted within the short time frame veterans have to dispute a debt. I mean, I hope that everyone on this panel sees the ridiculousness of this situation. This 94-year-old veteran who served his country and played by the rules and informed the VA of the passing of his wife to be hit with this financial burden when he can't pay for his life, and if they're going to take this money away from him. So my question is, why would it take 7 years for the VA to process a dependency change? It's not as if there was a delay in the reporting. The information was in the possession of the VA. And why is the financial burden shifted onto the veteran when they did nothing wrong?
So the first thing I'd say is that's so regrettable. I mean, there's no way I could justify what happened there. It should never take 7 years. I mean, the whole thing. And to be honest, in my current role, I've come across similar stories. So that's a complete failure on the part of the VA. What I would say, though, is that I sort of strike a balance between, being good stewards of the taxpayers' dollars and following the law, and also trying to protect veterans. In a situation like that, it shows all the things that we need to improve with the VA. I mean, where we want to get is we identify the debt early and work with the veteran. If it has to be repaid, and we have situations where you have people making small payments, small monthly payments, the debt will never be paid off, right? But we get them to a point, it's something they can afford, we're complying with the law. That's where we want to be in compassionate debt counseling. I mean, I hope those are the exceptions. I know stories like that myself, but it's absolutely regrettable. There's no way I could justify what happened there, not at all.
Well, I appreciate that answer, and I'd like to be able to work with you because there is simply, I mean, I think this case highlights exactly what you said, which is when rules are put in place and they're not followed by I mean, the veteran is following the rules, doing everything that they're
Right.
supposed to by the book, and then 7 years later, they're saying, okay, first of all, how are you even coming up with the dollar amount that is owed?
And I could tell you, as you were telling me that story, not to break in, I apologize,
Yeah.
but it made me think of a similar story that I heard of, in preparation for this similar story with an older veteran, just like some wacky things that the VA did that really caused problems for this veteran. This veteran was about 100 years old, and that's what we're trying to get away from, and that's sort of the challenge we face. I mean, I think we're making some progress, but I mean, there's no way you can justify situations like that. It just defies logic.
Well, I appreciate your willingness to at least, what I'd like to do is help work with you to try to address the situation for this gentleman, because obviously he depends on his benefits from the VA to support him as a 94-year-old man.
And we want to hear about those cases. We want to work with him. Any case that you have like that, any questions, if they can come to us, I really feel like we can work with the veteran and we can get them to a place that, it's something they can afford, or whether it's a waiver, compromise, or, getting rid of the debt. It's getting those before they get to that point.
Yeah.
Yeah.
Well, I
Preventing them in the first place, but if they happen, we want to know about it.
Well, I feel in your hands, obviously, I'm hoping that these issues that are highlighted just in this one anecdotal story can be fixed now that attention is brought to it. Thank you very much, and I will be in touch with you. And Mr. Chairman again, and Mr. Ranking Member, thank you very much for taking me out of order. I yield back.
Thank you. I'll now recognize myself for questioning for 5 minutes. Mr. Rochalski, thanks very much for your opening statement. As we know, this has been a large and consistent problem for years. The $1.6 billion figure that I cited here this morning has been pretty consistent over the last several years. So preventing overpayments has got to be a focus as part of the solutions that you outlined today. VA has a long way to go in many ways, including modernizing its accounting software, creating that portal that you spoke about. That has not yet been completed, and there should be some steps that can be taken to prevent these additional overpayments from occurring. So I'm wondering if you could talk a little bit about the structure of VA and how it's set up to address such a big systemic challenge like this. Ultimately, who's responsible for reducing these overpayments? Who's in charge?
So ultimately, I am responsible for reducing the overpayments. And with respect to the structure, sort of as I described in my opening statement, we're highly federated, and I think that we have a lot of people with good intentions, but working in a somewhat antiquated system and a highly bureaucratic organization where we want to be. And the other thing I would say about that is we don't make use of all the potential sources of data and intelligence that we could to identify situations like that. That said, in my own mind, I've thought of areas. How could we eliminate some debt? And I'll give you an example. I at one point was an active reservist. I had a VA disability, and so in some cases we're not going to be able to, I think, prevent the debt. And I'll give you an example. I was an IMA, an individual mobilization augmentee, and there would be times I would decide fairly soon that I was going to do my IMA days, like maybe tomorrow and the next day or even next week. There's probably no way the VA is going to know that. So some of this is going to happen. The thing we need to do is sort of bring this together to where we're using all of the intelligence that we have available to us, whether it's through computer matching agreements, other information in the VA, to try and anticipate and prevent. And we're a ways from doing that. So what we can do now is try and expedite things like the drill pay matching, getting dependency notifications in the system as quickly as possible. I think those are the near-term things to try and bring this down. Longer term, we need to become much more sophisticated in how we go after the information that's available out there and engaging with the veteran.
Well, I appreciate those comments. One of the things we need to insist on is a timetable for this. Can you give us some specific dates on when you'll hit those marks?
I can. As I mentioned in my testimony, so these are sort of my goals for the year, and I'm very comfortable that we can meet these. There are some stretch goals we have as well, but in the near term, the online notification, online availability of statements, I mentioned that for VHA, we expect in the next 3 to 4 months, a beneficiary, a veteran, can go online and see what they owe to VHA for medical copayments, things like that. For VBA, electronic notification, this is where you can sign up and receive things electronically, right, via email, or you can still get it via mail. We think by mid-2020, and by that I mean mid-fiscal year 2020, so March, April timeframe is what we're looking at for that. With respect to drill pay, this is another big area. It used to be back in the day, and when I was in DoD, when I was a drilling reservist, they did that annually. They would get a download from the Defense Manpower DMDC data center. They would do an annual reconciliation. They would do a batch mailing out to veterans. So over the course of that year, debt accumulated, right? Well, now they get real-time feeds from DMDC, and they're in the process of working this such that they can do monthly matches, and they can take it from a year to the month that the veteran did their drill pay. I can't give you an estimate of the magnitude of what that's going to mean, but I think it's going to be substantial. And so we expect that also in mid-2020 to be in place. Those are our big initiatives for the next year.
Well, the clock is running, and each day that these reforms aren't realized is another day that a veteran is overpaid and potentially put in dire financial straits as a result. As you mentioned in your opening statement, processes have evolved over time in recent years without regard for impact on individual veterans. And under current law, as you know, you're not supposed to pursue overpayments if the recovery would go against equity and good conscience. So can you comment on that in view of what VSOs and our offices have discovered about how some individual veterans have been treated?
You know, I'm going to defer that question to Mr. Schmidt because I think he works that day to day at the Debt Management Center. I bet he's got a better perspective on compassionate debt collection and the things that they do, how they go about this.
Thank you, sir. Thank you, Mr. Chairman. One of the things that we're doing, I'll just cover a series of things that the VA's Debt Management Center really is doing. Let's just talk real quick about outreach. We work with the VSOs across the United States to attend all the major conferences to make sure we can get ahead to prevent debt. So we work with the Veteran Service Organizations and school certifying officials. This last year, 10,900 of those people who reach millions of veterans individually, we've reached out with them, we've given them presentations, and thanks for their partnership. We often get recognition for those efforts to say, hey, here's what we're doing, here's how you can avoid becoming indebted to the U.S. government. For first thing, it's when we think about education, how do we think about when you change your rate of pursuit or you drop a class? If you do that before the time frame, well, that results in an overpayment. Well, let's not do that. Or it can also help school certifying officials when they go in and sign up for class, much like I did with my post 9/11 GI Bill, we're able then to understand that, hey, if you drop a class, this is what results. So it's really education on the front end really helps us out. In terms of the compassionate police, right, when it comes to the VA's Debt Management Center is delinquent, we do many things in the last year. We know, or last 2 years since we reported before this panel, we no longer take everybody's entire benefit check. We have an automatic 12-month repayment plan. And in those cases, when a 12-month repayment plan, it doesn't work, we work with them individually on a financial plan that works for them. So we do that in concurrence with them. Our debt counselors who work with veterans every day go through a 13-and-a-half-week academy. They're highly trained in understanding at-risk and veterans in general, and 44% of our workforce are veterans. Those are just to name a quick few, but we're doing a lot more in terms of compassionate care towards veterans. And we have debt counselors. They're not out there doing proactive calling. They're actually listening to their concerns, working with them, creating payment plans, and then validating. If it's a waiver or a compromise, let's look at the validity of this debt. And in many cases, if we find it's not, we can go ahead and refund that money.
Thank you for those comments. I want to now
Yes, sir.
turn things over to the Ranking Member, General Bergman, for 5 minutes.
Well, again, thank you, Mr. Chairman, and this is an important hearing. In fact, as I sat and I looked with the chart that was up here before at the 1.7 or whatever it is billion dollars, reminded me of my first term on the Budget Committee, where we were given the stat that every year, so annually, the U.S. government pays out roughly $150 billion with a B dollars in improper payments. And so when you think about the overall improper payment spending of the federal government, and this is not very large percentage of that, but I'll tell you what, if you're one of those veterans, it's a big deal. That other $149 billion really don't, that's not going to affect you, but this is a big deal. So again, thank you for what I've seen already in the progress that we are trying to make here. Mr. Richowski, dependency changes, such as a divorce or a change in the number of dependent children, are another source of benefit debt. In your testimony, you state that veterans can go online, send changes through regular mail, or call VA to initiate a dependency update. These options result in immediate changes to a veteran's disability compensation award, limiting the changes living the chance for an overpayment. In DAV's written testimony, however, they suggest that e-benefits only processes the addition of dependents and not the removal of dependents. Could you or somebody, on the panel clarify what dependency changes e-benefits can or cannot process?
Yeah, and I'm going to ask Charles Tapp to take that question. I believe it has to do with the requirements, documentation requirements associated with removing a beneficiary. So it's not a matter of the functionality of the system, it's more a matter of the requirements associated with it. But Mr. Tapp, I think, can help us.
Yes, thank you for that question. So I just confirmed again, just this morning, as far as e-benefits, it is true you can add and add spouses and dependents as far as dependent children, and you can also remove a spouse, but you cannot remove a child. That, because of the due diligence that goes along with it, requires more of a manual process to move those forward.
Okay.
Could I make just one clarifying question? And this sort of, where we sort of strike the balance with how quickly we do something and how much due process we give someone, and that's probably something that you're familiar with as well. There are some things that we could do faster, potentially, but we may limit the, the individual's ability to dispute a debt or due process. And I want to just give you one vignette, and I apologize I'll do it very quickly. But we had an initiative a while back, and Joe Schmidt can talk more about it, in areas that were hit by a natural disaster, where we thought, you know what, those poor people don't need to be worrying about their debt or paying debt, and so we're going to suspend the debts for everybody in this area affected by this natural disaster. What happened was a lot of people there did not like that. We did it proactively. We didn't notify them. We said, hey, your debt's suspended. You don't have to worry about it until everything's taken care of. We got a lot of negative feedback, that people that said, I'm not really affected by it. I want to keep paying this. Don't ever do that again. So now we have to sort of reach out. And so I only throw that out for your, for your consideration, that sometimes we can do things too quickly, or we think we're doing a good thing, and people are like, nah, not so much. So I apologize.
Oh, that's okay. Well, you tried to do the right thing, and then the people informed you it wasn't the right thing for them, but your heart was in the right place.
Yeah, so we hit and miss, but we learned from it.
Okay. Well, hey, Mr. Schmidt, VA's regulations provide that VA will take, quote, aggressive action, end quote, to recover debt, but also provide that when a veteran requests a waiver, VA is to apply an equity and good conscience standard. That's what you do. Would you please explain the DMC's role in the waiver process, and if you know how the equity and good conscience standard is weighed?
Yes, sir. Thank you for the question. I don't own the waiver process. We are initially referred with from the veteran to pass that over to the Committee on Waivers and Compromises with Veterans Benefits Administration. So I'll let them talk to the waiver process. But I would like to talk to you about when a debt comes to the VA's Debt Management Center and how we really follow through on equity and good conscience. And so every time a veteran contacts us, it's roughly at the point of 60 days post-initial notification. We work with them with our VA's Debt Management Center, debt counselors, to listen to their stories and to apply, whether it be a waiver, a compromise of the debt, whether it be an automatic repayment plan of 12 months. There's no further verification of income needed for those. But for those people who are even in further dire need, who have a debt that is unbeknownst to them or came to them as either a dependency claim, in those cases, we talk with them, provide financial status report, and then we give them extended repayment plans commensurate with the time that we had mentioned earlier. I think Ms. Rice had mentioned, Congresswoman Rice had mentioned that there had some time in between when it was initially submitted and came to fruition. In those cases, the VA's Debt Management Center makes a payment plan commensurate with the time also it took. In many cases, we can have payment plans in excess of 10 years. Okay. Now, for those folks with the American taxpayer may say that that's a long time, but the veteran, and also being a veteran who was $1.3 million indebted due to saving my son's life, I thoroughly understand the weight of what that requires, and we do my best, or our team does our best to really make sure we're taking care of them.
Thank you. I see my time has expired, Mr. Chairman. I yield back.
Thank you. Now I'd like to recognize Mr. Rose for 5 minutes.
Thank you, Mr. Chairman and Ranking Member, both for your leadership on this extraordinarily important issue. As a veteran, I understand in critical issues like this, they're there, but for the grace of God go I. So I'm really sick and tired of people thanking soldiers for their service and then screwing them over. And I know you all agree with me. So I'd like to tell you the story of just one veteran in my community, Staten Island and South Brooklyn. We really pride ourselves on being a place that looks out for vets, as I know many communities in the country do. So I was shocked when I heard of a case, though, in my district, resulting in nearly $18,000 in debt due to overpayment for just one veteran. This retired military veteran receiving disability benefits notified the VA of his pending divorce so that they could make appropriate changes. And in fact, a short while later, the VA confirmed that they received an electronic alert indicating that the divorce was pending. After doing his due diligence, this veteran, though, thought he was in the clear, thinking any fluctuation in benefits was due to a change in COLA. Until nearly 10 years later, this veteran finds out that because the VA did not have the actual papers received via snail mail to confirm this divorce, he incurred $18,000 in debt. Now, he has had large deductions to his monthly benefits, and now he needs to hire costly attorneys for an issue that he thought was resolved. This case is not unique. Can you imagine someone making a mistake and then you have to hire lawyers to help solve it? Greatest country on earth, and we have to do this to our veterans. So my first question to you is that can you commit today that you will work with my office and me personally so we can resolve this issue so that this veteran who served in uniform so we all could enjoy the freedoms that we enjoy today doesn't have to pay high-priced attorneys to fight his own country?
Yes, absolutely.
Okay.
Yep.
Thank you very much. What's going on with this snail mail thing? Why, if you get an electronic alert, have you heard problems like this before?
I have heard similar stories, yes, and I defer to Joe and Charles as well. I imagine they've heard of similar situations where a veteran has notified the VA and we haven't processed it in a timely manner, missed it, and they, as I mentioned to Congresswoman Rice, it's completely regrettable. And one of the things that we're looking at, how can we make this more fail-safe? In my own mind, one of the things to do is to have sort of multiple venues. We do use snail mail, but having more online presence.
But you admit that it's on you guys. Or you admit that you make.
We're notified, and we don't. Absolutely, 100%. I absolutely agree with that.
But he's the one bearing the consequences of the mistake.
And to your point, sounds to me in this situation, he did get screwed. There's no question.
So we are working on this issue, though.
We are working on.
That's
Yes,
a positive.
the issue that you're describing, we are working on. We're trying to find ways to prevent this from happening. Yes.
Okay. Is there any type of forgiveness for legal fees that veterans have to incur so as to fight the VA department?
I mean, I think I'd have to take that for the record. That's probably a legal matter, and I don't know it well enough. But I will take it for the record and get you an answer.
Okay. Anyone else on it? Anything else to add about this snail mail thing?
Yes, sir. So based on the timing that you mentioned as far as snail mail, there have been improvements in our processes as far as us intaking mail and scanning the mail so that it moves through our system much more quickly. Because you're right, 10 years ago, snail mail and getting to the right place at the right time was absolutely a problem. But again, in the more recent history over the last couple of years, we are scanning the mail, ingesting the information into the e-folder for a benefit for a military member or a veteran so that we can process those claims a lot more quickly.
Anyone else? All right, so I look forward to working with each and every one of you so we can resolve this case without high-priced New York City attorneys being involved. Thank you again.
Thank you, Mr. Rose. Now would like to recognize Mr. Roy for 5 minutes.
Thank you, Mr. Chairman. Appreciate it. Apologize for being late. As many of my colleagues, we were voting and then taking meetings off the floor and so forth. So here we are. I'm glad that I'm privileged to serve on this committee, where at least on a bipartisan basis, I think we tend to actually try to work forward and get things done together. Because I don't know if there's any place in the world that has more activity and less productivity than this complex. As we run around from committee to committee, and people wonder what we're doing. But at least here in the Veterans Committee, we're at least trying to accomplish some things. So I appreciate you all being here. I have missed obviously parts of it. I hopefully am not being too repetitive, but I do, having read through the testimony that was provided, have a question for Mr. Wachowski, if I might. In your written testimony, it states that the VA's Central Benefits Communication Management Program processes roughly 40,000 letters a day. Does that sound right?
That sounds right.
And that you're looking to move towards an opt-in electronic notification system?
Correct.
Is that right?
Yep.
And so if you just kind of do back of the envelope on that in terms of cost, 40,000 letters, you probably get a bulk discount rate on postage, whatever that rate is, but times 365 days. I mean, you're at, I don't know, $8 million or something, depending on what the postal rate is, it might be. Sort of an annual cost of about $8 million or something on postage alone. Have you estimated what the cost savings of moving to an electronic notification system could be?
I have not specifically, and I don't know that we've done a cost estimate. I also don't know factually if we could completely, and maybe we could completely stop the regular mail if they opt in. So that's actually a very fair question, good question. I'd have to sort of get back to you on what we can do and what cost savings. But I agree with you, there could be substantial cost savings.
Okay, that'd be great. Appreciate it. And then Mr. Schmidt, I also serve on the Technology Modernization Subcommittee, and I've been closely looking at and reviewing the VA's electronic health record modernization effort. It's the thing I hear a lot about in the district. I've got Audie Murphy in San Antonio, and we've got 80,000 veterans. We've got the VA in Kerrville. And so, I hear a lot about, as we're moving to mission, and the follow-up to choice, about how getting this right is critical to those things functioning. And so I think that's really on the hearts and minds of the veterans that I talk to. When they go, well, we love the idea behind mission and what's happening, at least what we hear. We loved conceptually the idea of choice. So we're hoping mission will fix some of those things, move it in the right direction. But this question, right, about having records and then how that works for them and bouncing in and out and going to a doctor and then coming back and all of that. So my question is, it's my understanding that the new I remember hearing, we had not too long ago, the new Cerner health record system includes debt management capabilities in block 2 of the implementation timeline. And what improvements to the billing and debt management process does the new platform bring, and what challenges does it present?
That may be a question better for Susan Reed.
Sure, great. Yeah,
is
sorry about that. That'd be great.
Yeah.
That's okay. Thank you for that question. At this point, I think it might be too soon to tell. That is definitely something that we are looking at as we go through our planning for the rollout of the EHR. I think the important thing that we want to keep in mind is that we want to make sure the veteran is in the center of that implementation.
Okay, thank you. Appreciate it. More questions?
Thank you. I'll now recognize Mr. Cisneros for 5 minutes.
Thank you, Mr. Chairman. Thank you all for being here today. It stated, or that I read, that the VA will not charge a veteran for the Veterans Administration's own mistake. Is that true?
Well, if there is an overpayment, even if it's the VA's fault, legally, I'm obligated to get repayment on it. So I think it's not depends on your definition, but not 100% true. If we make a mistake and overpay someone, I'm legally obligated to try and collect that debt.
Right. So, but there is a waiver process. Is that correct?
That's correct. And one thing I would say about the waiver process, and my colleagues can correct me, but the numbers that I saw is about 50% of the waivers that are submitted are approved. Is that, yeah, I think so. Yes, there is a waiver process, about 50% are approved.
So what is the process for waivers, and how does one go about, who reviews these waivers, and how do they get approved?
So I'm going to ask either, maybe Charles Tapp's probably the best, since they own the waiver process, to sort of walk you through the life cycle.
Yes. So when we have a situation where a veteran comes forward and requests the opportunity for a waiver or compromise, basically we have three centers, two that deal with compensation and pension and one with education. Basically, they submit their case that includes a financial worksheet. And basically, we go through a checklist to evaluate the ability for a veteran to actually repay that debt based on their financial situation or circumstances. This fiscal year, we've had 27,000 cases that's come in, and 58% of those have been approved. But again, it's based on their financial ability to make a repayment.
So Mr. Schmidt, you talked about a 12-month repayment plan. Is that only for in regards to the GI Bill, or is that regarding to all overpayments?
Yes, sir. It's regards to compensation and pension debts alone. And so for those compensation and pension debts that are out there, we offer a automatic 12-month repayment plan.
Okay. So, you know, when I was in the Navy, one of actually was my first job that I did. I was a dispersing officer. So I was in charge of paying everybody. And kind of similar when somebody would get overpaid, you know, the government always takes their money. If there's no questions asked, it doesn't matter, and they don't really think, they just take back, and they would at times take a person's entire paycheck. You know, we always worked with them in that situation to try and make sure that they had the funds, and you know, I always had the ability to go and to do that and to make that happen. But you know, with these situations right now, when you run into someone who has an overpayment in your situation, you said you're legally obligated to take that back. And even though it may be in a situation where there is a payment plan, it's always been at least when I was doing it there, and I'm sure it's probably still the standard now, that the government is always going to go and take their money first. So when to get into this payment plan, is the money taken away first, and then there's a process to kind of pay it back, or what is the process to get into this payment plan?
Yeah, so I think it's automatic. What happens is the veteran is notified of the potential existence of this debt, and they're asked to, and they're given some options, and you know, we can debate whether the letter is clear or not. I mean, I can tell you I've read the letters. They're not that clear, to be honest, and we're going to work on that. But we, over a series of letters, we ask them to contact us. If they contact us within 30 days and they have a dispute, or they want to waive it, or a compromise or something like that, they don't pursue collection. So they have some time there to sort of figure out what to do. If we don't hear from them, eventually what happens is, and they're what we call an active client, where they have a VA payment going out. Eventually, that will be decremented. And what Joe was saying is, instead of doing it all at once, like I'm used to military pay doing, they'll do that over 12 months. The veteran can contact us and let us know that even that 12 months isn't going to be enough. The key is if the veteran sort of gets engaged early, the obligation on us is to get the veteran notified, if that answers your question. But it doesn't come out all at once. It comes out over 12 months unless we work out something. But there are a lot of options for the veteran, whether it's not just a waiver, it could be a compromise to pay less, a dispute, to have the debt set aside entirely.
All right. Thanks for your testimony. I yield back my time.
Thank you, Mr. Cisneros. Well, we are hearing bells, which means we have some votes to tend to. We appreciate the panel for being here today. So Mr. Rochalski, Mr. Schmidt, Mr. Tapp, Ms. Reed, thank you for joining us. We hope to look for ways to continue this conversation in the coming months and years to stay on top of this situation. As I mentioned, our offices continue to receive lots of calls from individual veterans who are experiencing overpayment, and we need to make sure we're addressing this situation in a way that doesn't put them with this significant financial burden moving forward. We appreciate your commitment to that, and we will pick this up after votes with our second panel. So with that, the subcommittee stands in recess.
Thank you so much.
Thank you. The hearing will come to order. We are back, and we are now joined with our second panel of witnesses. I'd like to introduce them here today and thank them for joining us. First, we have Mr. Shane Learman. Mr. Learman is the Deputy National Legislative Director for Benefits at the Disabled American Veterans. The subcommittee thanks you for appearing today, and Mr. Learman, we'll turn it over to you for 5 minutes.
Thank you. Chairman Pappas, Ranking Member Bergman, and members of the subcommittee. On behalf of DAV's more than 1 million members, we thank you for the opportunity to present our views at today's hearing. Our full written testimony addresses our recommendations for debt reforms regarding drill pay and incarcerated veterans. However, this afternoon I will focus our recommendations for dependency status change and debt collections. Mr. Chairman, we understand that in an imperfect claims processing system, there will be overpayments, and it is a reasonable expectation that recipients of such overpayments are required to repay that debt. However, we believe that a significant portion of overpayments can be reduced or avoided. VA's lack of timely action causes additional overpayments, and that places additional financial hardships on veterans and their beneficiaries. One of the most common ways that an overpayment is created is when veterans report a change in their dependency status. Veterans in receipt of VA compensation at 30% disabling or higher are entitled to additional monthly benefits based on the number of their dependents. Veterans are required to advise VA of a change that will remove a dependent, which will result in a reduction in their monthly compensation. But if VA delays the processing of that request to remove the dependent, it creates an additional amount of debt that the veteran or the beneficiary is responsible to repay. Mr. Chairman, VA's adjudication manual lists all dependency actions as non-rating work end products, or EPs. Non-rating work EPs are not considered part of VBA's backlog management and reporting of days pending for processing. This means that non-rating work EPs are a low priority. In fact, currently there are over 211,000 pending claims to add or remove dependents within VBA. The VA OIG report of September 2007 indicated an estimated $50 million in overpayments were avoidable and found the main reason for the delay in processing dependency status changes is due to its classification as non-rating claims. We have two recommendations to assist with these delays in processing dependency claims. First, assign dependency claims as rating work end products. This will require VBA to consider all dependency changes as rating work. While this will increase the number of pending claims by assigning a rating work end product code, it will reduce the additional amounts of overpayments that are created by VA's lack of timely action. Second, allow veterans and beneficiaries to remove dependents from their award electronically in real time. Through VA's e-benefit system, veterans can electronically add dependents, and VA will usually make the additions within 48 hours. However, there is not an immediate way to remove dependents electronically. To reduce the additional amounts of debt created by not prioritizing these claims, VA must allow veterans to remove dependents from their award as easily as they can be added. In terms of reforming the overall debt collection process, I want to highlight two of our recommendations. One, reduce the amount recouped or offset from monthly compensation checks. When VA recoups the entire monthly compensation check until the debt is repaid, or even in 12 months, this creates a serious financial hardship and can actually cause more harm to the veteran and their family by collecting it through their monthly compensation. We recommend that VA reduce all offsets and recoupment to 25% or less of their monthly payment. Number two, waive all amounts of debt created by VA's lack of timely action. As noted, large amounts of additional overpayments are created by VA's low prioritization and lack of timely action, as was noted earlier this afternoon. The veteran should be responsible for the amount of debt they create only, and not being taxed with the additional amounts created by VA's lack of action. In closing, additional overpayments created by VA and the resultant debts often cause severe financial hardships for veterans and their families. In many cases, the burdens of repaying these debts can negatively impact a veteran's quality of life, put them at risk of homelessness, and affect their access to VA health care. We must reform VA's debt policies to ensure we protect veterans from additional harm. Mr. Chairman, this concludes my testimony. I'd be pleased to answer any questions you and the members of the committee may have.
Thank you very much, Mr. Learman. I'll now recognize our second witness, Mr. Carlos Fuentes. Mr. Fuentes is the Director of National Legislative Service for the Veterans of Foreign Wars, and the subcommittee thanks you for appearing here today. Mr. Fuentes, you have 5 minutes.
Chairman Pappas and General Bergman, on behalf of the VFW and our auxiliary, would like to thank you for the opportunity to present our views on how VA can effectively prevent and manage overpayments, having to deal with erroneous forfeiture of benefits or financially constraining repayment plans have a detrimental impact on the well-being and livelihood of those who have worn our nation's uniform. The majority of veterans the VFW assists with overpayment issues results from confusion or errors with education benefits. Through the VFW's One Student Veteran Program, we have been notified by countless veterans who have received debt notifications because VA administrative errors have caused overpayments. The VFW also hears and addresses overpayment issues through our network of more than 2,500 highly trained VA accredited service officers around the world. Changes in dependency claims is the most common reason for overpayments in VA disability compensation. VA's inability to timely address concurrent receipt issues also cause overpayments, which VA is later required to recoup. For example, a veteran who is still a National Guard or Reserve component is not eligible to receive VA disability compensation and drill pay concurrently. VA's delay or errors in processing such adjustments commonly create overpayments for veterans. The VFW urges Congress to eliminate the concurrent receipt issues that often result in veterans or their survivors having to repay benefits they should be eligible to receive, but have to pay back because of misguided laws that require them to forfeit one earned benefit for another. Once a overpayment is noticed, VA will send ambiguously worded notifications of overpayments, which also provides options for repayments. If veterans are unable to contact VA to contest the debt, provide repayment, or enter into payment agreements with VA, their debt is sent to collections, and VA will begin garnishment of their disability compensation benefits until the debt is satisfied. While veterans have the ability to seek relief by requesting a waiver, VA's inability to provide them with clear and concise information regarding their debts in a timely manner significantly hinders their ability to take action. In a perfect world, discrepancies will be noticed and addressed immediately. However, there have been instances where it has taken upwards of 5 years and 10 years for VA to properly notify veterans or notice overpayments. In some instances, veterans themselves have to notify VA before any action is taken. To its credit, VA has made concerted efforts to eliminate overpayments, and in some cases informed veterans that they will not be held liable for overpayments, but more must be done. VA's inconsistent administration of veterans' benefits, misinterpretation of rules and regulations, lack of training for program administrators, and lack of effective communication with veterans are the principal reasons for VA continues to overpay veterans. Many veterans, especially those on fixed incomes, have limited access to financial resources needed to immediately repay an overpayment. However, VA will often offset a veteran's entire monthly disability compensation benefit in order to pay down a debt without the veteran knowing about the debt or being afforded the ability to request an alternative method of payment or relief. This is why the VFW has supported legislation that would require the use of certified mail when notifying a veteran of debt. And to address confusion letters, the Veterans Benefits Transition Act 2018 required VA to collaborate with veteran service organizations to develop a standard in plain language format for all the debt letters sent to VA to veterans. The VFW is unaware of the development of such standard format and urges the subcommittee to inquire about its status. Plain language letters, which detail debt, will have a significant impact and be able to provide veterans the ability to seek relief. The VFW also urges Congress to pass S-805, the Veterans Debt Fairness Act of 2019, which would improve VA debt collection process, limit VA's authority to recover overpayments caused by administrative errors, and improve the due process afforded to veterans with respect to such recovery. Mr. Chairman, that concludes my remarks. Thank you for the opportunity, and I'm happy to answer any questions you may have.
Thank you very much, Mr. Fuentes. I'll now recognize our third witness, Mr. Mike Saunders. Mr. Saunders is the Director of Military and Consumer Policy at Veterans Education Success. Subcommittee thanks you for appearing here today, Mr. Saunders, and you have 5 minutes.
Chairman Pappas, Ranking Member Bergman, and members of the subcommittee, thank you for the opportunity to provide input on VA overpayments and debt collection procedures. Veterans Education Success is a nonprofit organization that provides free counseling and legal assistance to students using their GI Bill and military education benefits and works to advance higher education success for all military-affiliated students. We greatly appreciate the subcommittee's attention to this very important issue, and I'd like to thank the VA for their recognition of the problem, but action is required. We have helped approximately 5,000 veterans with GI Bill problems. We have seen a recent uptick in the number of military-connected students who are experiencing VA clawbacks of their hard-earned GI Bill, giving us a first-hand view of how opaque and frankly Kafkaesque the process can be. Veterans' complaints largely fall into two main overpayment situations: overpayments for a dropped class and retroactive readjustments of GI Bill benefits awarded to a veteran. GI Bill overpayments warrant this subcommittee's attention. A 2015 GAO report found a startling 1 in 4 post-9/11 GI Bill students experienced GI Bill overpayment. According to GAO, 90% of GI Bill overpayments are caused by veteran enrollment changes. The problem is that VA disperses the entire term of post-9/11 GI Bill benefits after a veteran sits for just 1 day of class. If students drop out or drop a class after the first day, the school still gets the tuition and fees for the entire term. This incentivizes some unscrupulous college recruiters to lie to veterans to get them to enroll, knowing the student will likely drop out quickly. Worse still, VA comes after the veteran for the overpaid tuition, even though the tuition never touched the veteran's hands, but was sent straight to the school. This defies common sense. Students are being asked to come up with tens of thousands of dollars that they don't have and never touched. In contrast, the U.S. Department of Education delays disbursement until after the typical college add-drop period and claws back tuition from the school, not the student. We thank the Subcommittee on Economic Opportunity and many members here today for working with us to solve this through the bipartisan Forever GI Bill Class Evaluation Act, which would delay GI Bill disbursement until after the typical add-drop period, and the bipartisan Student Veteran Empowerment Act, which would require VA to verify post-9/11 GI Bill enrollment on a monthly basis, as it already does for the Montgomery GI Bill, rather than waiting until the end of the semester. Another problem we urge the subcommittee to address is retroactive readjustment of education benefits. One case brought to VES involves a beneficiary who had the post-9/11 GI Bill transferred to her by her father, who was assured by his personnel office that retiring 33 days before the end of the 2-year service obligation he incurred for transferring his education benefit would not affect that benefit transfer. VA approved her GI Bill and she went to college. Nevertheless, 7 years after her father retired and 6 years after she graduated, VA sent her a debt collection notice stating that she owed up to $100,000 and that they were also going to restore her father's education benefit, in clear contravention of the wishes of the family. If a veteran lied to VA, then VA should go after the veteran. But VA administrative errors are not a veteran's fault. If VA certifies a student's eligibility, it can't ask for repayment 6 years after the student relied on VA's approval and graduated. Now, turning from GI Bill specifics to VA's overall debt collection practices, we have identified a number of critical problems we hope the subcommittee will address. First, VA's aggressive collection tactics are on their face in opposition to VA's emphasis on serving those who have committed to defend us. For example, GAO found that VA collects nearly all its debts by withholding a veteran's other benefits, such as withholding entire disability payments. If you take that much needed money, veterans have to choose between paying for food, medicine, or housing. Importantly, VA's regulation calling for aggressive debt collection goes well beyond what is called for by statute. We urge the committee to require VA to bring its regulations in line with statute and to also forbid VA from taking more than 25% of a veteran's benefits to cover unrelated debts to VA. Second, VA's aggressive debt collection methods are particularly unfair given the VA relies on outdated methods of notifying veterans. VA's letters alerting veterans of a debt are often confusing and sent to outdated addresses. As one military-connected student who came to VES for help said, "I don't believe a human has looked at any of the letters I have been sent. They don't add up or make sense. Semesters are omitted. Figures they quote as to what I owe on one document don't match with figures they quote on a different document. Dates and explanations don't make sense." In sum, we firmly believe VA can do better, and we request the committee's assistance in ensuring this happens. Thank you for the opportunity to present our views, and I am ready to answer any questions you may have.
Thank you very much, Mr. Saunders. I'll now recognize our fourth witness, Mr. Gerardo Avila. Mr. Avila is the Deputy Director for Military Boards and Memorial Benefits at the American Legion. The subcommittee thanks you very much for appearing here today, and you have 5 minutes, Mr. Avila.
All right, thank you. Chairman Pappas, Ranking Member Bergman, and distinguished members who probably serve on the subcommittee, on behalf of our National Commander, James Bill Oxford, thank you for the opportunity to comment on an important issue of the Department of Veteran Affairs overpayment and veteran debt collection practices. It is my duty and honor to represent the American Legion and assist this committee in better understanding this issue, how it impacts our veterans, and provide recommendations for improvement. It is crucial that we address these issues in an effort to ensure that we are not unduly burdening America's veterans with debt as a result of bureaucratic inefficiencies or errors. Every veteran understood that when they volunteered to serve their country, it would come with sacrifice and hardship. What they didn't expect is to be placed in a hardship situation by the very institution who is supposed to be there for them. It is the Legionnaires' collective experience that the creation of overpayments are doing just that. Over the years, VA has made progress in reducing overpayments. However, there is still significant room for improvement. The American Legion last testified before this subcommittee on the issue of VA overpayments and debt collections on May 24, 2017. During that testimony, we focused on the initial cost of debt, communication between the VA and the veteran, the collection process, and the garnishment of an active benefit. The American Legion has seen improvement in several of these areas. Firstly, the American Legion would like to commend VA for taking a proactive role in reducing the dependence claims backlog and initiating new methods enabling veterans to personally update their dependent status via phone, scan, and e-benefits. Due to these efforts, we have seen a reduction of the debt involving dependency claims. Another area of improvement has been the reduction in amount owed due to simultaneous receipt of drill pay and disability benefits. While drill pay remains a large originator of debt at VA, collaboration with the Defense Finance and Accounting Service has reduced the total amount owed. The American Legion is encouraged by these efforts and implores these agencies to continue to work together to eliminate overpayments completely by increasing the frequency which they rectify their accounts. We also encourage that VA has instituted a more forgiving process when garnishing an active benefit as a means to repay a debt. The old practice of garnishing the entire amount resulted in many veterans facing financial hardship. Veterans and their families rely on the monthly VA benefits to make ends meet. While these improvements are a step in the right direction, we have the following recommendations. Internally, VA must fix the lack of integration between the various information management systems. The lack of interoperability results in issues ranging from incorrect addresses to not being able to provide a clear answer on the initial source of the debt. In a perfect scenario, all IT systems will generate a veteran's latest status and most up-to-date information. Additionally, most accredited representatives do not have access to the various systems that VA utilizes. This lack of access makes it nearly impossible for representatives to assist the veteran in navigating the complex and confusing network. In a recent pension case we assisted on, we found that the medical documentation needed had been provided to the VA, but had not been processed by the pension center. Since there was no contact with DMC, the amount owed was referred to the Treasury Department for offset. Thanks to representatives, we were able to track down the medical information and provide it to the pension center to avoid further harm. As a result of issues like this, the American Legion calls upon VA to continue to integrate its information management systems and expand access to accredited representatives. The best solution to avoid an overpayment is for VA to immediately be notified when a veteran's status has changed. Information like change in net worth, monthly drill, or incarceration is already being collected by different entities, who in many cases are the first to become aware of this change. The goal should be to develop partnerships with key agencies to ensure critical information is accessible and can be provided to the veteran. In an effort to eliminate overpayments, the American Legion urges VA to aggressively seek out partnerships and collaborate with as many agencies and organizations as necessary to correctly reflect a veteran's current status. The American Legion agrees that if a veteran receives a benefit they are not entitled to, they should have to pay it back. What we disagree with are some of the collection practices used that have resulted in unnecessary financial harm to our veterans. From our recent meetings with VA officials and through our daily interactions with the DMC, we feel that the employees' hearts are in the right place. By implementing our recommendations, the VA will put itself on the path to solving the overpayment issue. We would like to thank this committee once again for the opportunity to testify on this important topic, and I'll be happy to answer any questions.
Well, thank you very much for the testimony of the 4 members of this panel here today and for your dedication on a daily basis to all those who have served and are serving our nation. We really appreciate your advocacy and your presence here today. We'll begin the questioning portion of this panel, and I'll begin by recognizing myself for 5 minutes of questioning. I want to focus in a little bit on the letters that were talked about with the VA earlier and were alluded to you by some of you here today as well. We all know that Congress passed a law that requires the VA to work with veteran service organizations to improve these letters to veterans. We've heard stories about how veterans can receive multiple communications that are many times quite confusing and opaque. So I'm wondering how the VA has worked with your organizations to improve these letters, and do you think the VA has made improvements in recent years in debt collection notifications and in ensuring that these notifications are clearer for our veterans? That's open to the entire panel.
Thank you, Mr. Chairman. The reason it gets so confusing is they always send 2 letters. First, the VA regional office, if it's a debt created by a dependency issue, they'll send a letter to the veteran notifying them there may be an overpayment, and they may owe money to the VA. Then they'll get a separate letter from the Debt Management Center, sometimes 2 to 3 weeks, sometimes months later. And then that letter doesn't provide any information other than, here's how much you owe us, and if you don't take action in 30 days, we'll take your monthly compensation check. So that's the way the process currently works, and I don't believe they've reached out to us anytime soon to discuss any of the new letters. I know that recently VA has shown us letters after they've already drafted them, but I'm not aware of any current ongoing discussions about improving those with the VSO's assistance. Mr. Chairman.
I have seen a report from VA saying that they're working on the standard plain language format that's required by the Veterans Benefits Transition Act 2018. But we talked to all the folks over the VFW who would be invited to these meetings where they would collaborate with us, and none of us are tracking any invitations. So I don't know if they're forthcoming or not, but so far we have not been engaged in that discussion.
No, not on this issue. We have not worked with the VA at all. And just to echo what Shane said, the case that I referenced in my opening statement, I actually saw all the documents that beneficiary got from the VA. She got her initial statement from the regional office laying out why they thought she owed a certain amount of money. And then she got 3 different letters from Debt Management Center that totaled up to $100,000. The first letter said she owed $68,000, so it wasn't even clear how much she owed.
The process is pretty unclear.
I would agree with the letters. The letters that we have seen were more on the VVA side, notifying when a veteran is service connected, but not necessarily specific to the debt management and the collection process. And I think just to echo on how the debt is created, obviously everyone knows at the regional office, and they're the ones that have the detail, and maybe and they send out the notification. And if the veteran did not get that, then the next letter they're going to get is going to come from DMC. DMC might have limited information. I think this goes to a point about the integration of the IT systems. So if every IT system had the correct information, DMC would not only have a dollar amount, but they would be able to explain to the veteran when they call about why do they owe this amount. And I think nobody likes to pay money back, but if you're given the reason why you owe, then you say, okay, yes, that is correct. And I think veterans would be more willing to pay the debt if they knew the full information.
Well, thank you, and I'm just curious if each of you would be willing to be available to work with the VA on this problem moving forward. If we could just have a yes or no, if you'll make yourselves available to the VA to be consulted about the issue around communications.
Absolutely.
Yes, and we feel it's absolutely necessary.
Yes.
Correct, we will be.
Well, thank you for that. You know, I was struck by many of the examples of real problems that are caused by these debt collections that we heard in your testimony here today. Clearly, these show that just the nature of the problem and the frustration that is felt by veterans and their families causes harm. Mr. Learman, I'm wondering if I could just ask you a little bit about drill pay and disability compensation. I understand that VA is proposing to suspend compensation benefits when it receives notice that a veteran will receive drill pay. Can you speak to your concerns about that specific proposal?
Yes, Mr. Chairman, thank you. The way the current process works with drill pay is the VA will not take any action until they're notified, generally by DOD. If the veteran notifies the veteran notifies the VA in advance of their drill pay, then VA can start taking actions and collecting that amount. In the proposal, the proposed legislation that was introduced earlier, they're suggesting that they stop paying the veteran if the veteran may receive drill pay. Without him actually or her being on active duty getting that drill pay, their proposal is to stop the payment the minute they find out they may receive it before they even get it. So our concern is, one, VA is not going to pay them their compensation because they believe that they're getting drill pay. Two, if their drill pay status or their drill changes, which is very common for a lot of people in the Guard and the Reserves, orders change quite frequently, then they won't get an active duty check for that month, nor are they getting their VA compensation check that month. And the VA is proposing to take away the due process portion of that as well. So while they're trying to correct the problem, we think they're creating a larger problem by taking away that due process, and essentially the veteran may not receive any pay for that period from his drill or guard duty or from the VA, and that's a big concern for us.
Okay. My time is up. I'd like to turn it over to our ranking member, General Bergman, for 5 minutes.
Thank you, Mr. Chairman. Mr. Learman, let's just kind of continue down that road just a second on that question that the chairman just asked. So, as you characterize the details of it, of what they would do, would that be in your mind considered be one of those non-technical barriers to achieving a goal, or is that just a way of doing, just a way of doing business? Could we? Is there a way to not do that?
I think, as they reported earlier, if they do more reporting and they do monthly reporting of when drill pay is being paid for veterans who are also getting compensation, I think that's a better way to do it. If we start collecting before they're being paid, I think that's just a horrible way to go and putting veterans in a more vulnerable position than we already are. That was a proposed piece of, it was a proposed regulation in April. There's no more comment periods. It's closed. We're just waiting for them to drop the final rule and address all of the comments that were submitted in April.
Okay. Well, again, there's been a suggestion that there are non-technical barriers in a different subject to removing dependents through e-benefits. Do you know what those non-technical barriers are, Mr. Learman?
I'm not sure what the VA meant by non-technical, but Here's how we view this as being real simple. The veteran gets to choose who they receive benefits for. They report their number of dependents. So if the veteran says, I want to remove a dependent, I don't see how that becomes a technical problem or a larger problem on VA, because now they're paying less money out. Generally, when you have to add a dependent, they require a lot of information, birth certificates, marriage certificates, but they've waived all of that in the benefits to allow you to do that instantaneously. So we don't understand what their barrier problem is in allowing them to remove them instantaneously in e-benefits.
Okay. Mr. Fuentes, you got any big events going on this week?
I do have a personal one.
What would that be?
Expecting the first child tomorrow, so
Congratulations.
thank you very much.
That's a big deal. Just remember, you cannot give a baby too much love. It is absolutely impossible. Just try to remember that when they're 2. Now, Mr. Fuentes, on a more serious note here, the situation at hand here, concurrent receipt of drill pay and VA benefits is one of the VA's, the VFW's, top priorities. Do you have any examples of how it affects the average veteran who chooses to continue serving in the Guard and Reserve after they separate from active duty?
General, I served under you, very, very, very far under you when I was in the Marine Corps Reserve.
You were the reason I had a job. My job is to serve you guys.
Thank you, sir. And I'm sure you can relate as much as I did that you can't live off of drill pay, right? And we're using the reserve component a lot more to fight today's wars than we have in previous years. So we need reserve component service members. This is one of the reasons that folks will want to leave, right? So they're either required to forfeit their earned benefits, right, because they're disabled veterans, or work for free. Those are just not viable options. And then on top of that, because of bureaucratic issues, they are now faced with, this, I have an example here, $32,000 in debt that they have to pay at once or find a way to collect the money to pay for it. That's unacceptable, and our view is that we just need to get rid of the issue by getting rid of the requirement to collect or forfeit VA disability pay.
Okay. Well, Mr. Chairman, and I see my time's about up here. I think it would be a good issue for us to look into to see, as Mr. Fuentes states, we need to retain good men and women in the Guard and Reserve, especially with all the experience they've gained. And we need to make sure that we're not creating a barrier. Again, there's a cost to everything, but we don't want to create a barrier to long-term retention of good folks. So with that, I yield back.
Well, thank you very much. And if the ranking member would indulge, just a couple more questions here before we conclude. I'd like to get a couple more issues out there. And Mr. Avila, just one for you. Your testimony notes that in the first 30 days of the debt collection process, it's a crucial time frame for our veterans to receive protection from garnishment. 30 days isn't really a sufficient time to complete that required action. So what can the VA do to ensure that veterans are able to receive protection from garnishment?
So you're absolutely correct. The first 30, a veteran can request a waiver up to 180 days, but the first 30 days that we mentioned, that's the crucial period to avoid any garnishment and affecting their benefits. And we already know from issues that sometimes the veterans did not receive the notifications, the initial notifications. So we believe and we support a movement to up to maybe 90 days. And this will give the veteran ample time to respond back to DMC and to take appropriate action before any garnishment or possible loss of benefit can incur.
Well, thank you, sir, for that. And Mr. Saunders, one for you as well. Surprised that there's such a disparity between how the VA handles this issue versus other agencies of our federal government, including the Department of Education. And I'm wondering if you can explain how DOE deals with overpayments and if there's anything that can be learned from VA in how to approach these issues with veterans.
Thank you for the question, Chairman. The Department of Education pays out their federal education money in stages. They certify that a student's enrolled in the beginning, and then they pay it out after the drop period, and then they have another period at the end of the semester when they pay a final amount of money, and they claw back any overpayments from that final amount that they pay the schools. So they're taking the money from the schools, and it smooths out the process for the students.
Well, thanks for that. And I guess as it pertains to our veterans, that sort of planned out process is a lot easier for them, many of whom are living paycheck to paycheck, just like most Americans.
Absolutely. In the in the add drop period, a lot of people add drop classes, and communicating to people the impact that can have on your benefit, it's unfair to the veteran to force them to take classes that they wouldn't take and any other student wouldn't be forced to take.
Well, thank you for that. General Bergman, I think, had one additional question here.
Yeah, thank you, Mr. Chairman. 5 minutes goes fast, but we got a lot of meaty things here to discuss. Mr. Saunders, in your written statement, you commented that VA should try to reduce the amount of retroactive adjustments for GI Bill payments, which amount to VA making a processing mistake and then going back to the veterans to make up the difference once the mistake is found. Why would these veterans not have a case to ask for equitable relief in these situations?
That's a great question, General Bergman. So equitable relief is it's like a final remedy. It exhausts all your future appeals with the VA. It is a way to get it done, but if for whatever reason, some situation it wasn't resolved completely, you would prefer the process be handled by waiver. You would want to go to VA's Education Service and have them tackle the problem. That's the preferred way, is to have human eyes on it.
Okay, good. Well, thank you very much, and I appreciate the extra time, Mr. Chairman.
Absolutely, anytime. And I think before we close today's hearings, I just want to thank once again our folks on the second panel here today for your responses and your willingness to continue to be a part of the solution moving forward. And I thank as well the Department of Veterans Affairs for sticking around and for their input on our first panel. Just some concluding observations. I think this afternoon we heard from VA officials that preventing these overpayments is an important goal they're working toward. We also heard from them that providing clear guidance, direction, and support for veterans is another important goal. We also heard from those working with and advocating for our veterans here today that too many people continue to suffer confusion, frustration, and financial harm as a result. VA's testimony did not lay out for us a clear path toward preventing hundreds of thousands of veterans receiving debt notices each year. It seems all too likely that the subcommittee could hear testimony a year from now showing that another $1.5 billion in debt collections is outstanding, which was the same level around the time of this subcommittee's last hearing. I wasn't satisfied wholly with the VA testimony that tried to outline steps for ensuring that the department communicates clearly and effectively with veterans even after new requirements were put into law last year, and I think more work needs to be done there. I appreciate our veteran service organization's commitment to be a part of that. It's worth repeating that the many different parts of VA involved with notifying veterans and collecting debts is a major obstacle getting in the way of reforms. Ultimately, fixing debt management will mean a VA-wide solution. General Bergman, I believe that our staffs should work together with the department to address these issues and needs, and I think this should include legislation for any possible new authority and requirements that would help this situation. So, Mr. Ranking Member, I'd like to give you any time you'd like for any closing remarks. Well, seeing none, I wish to express again my appreciation to all the witnesses for appearing here today for your thoughts and views. And members of this subcommittee will have 5 legislative days to revise and extend their remarks and include any extraneous material. So without objection, the subcommittee stands adjourned.
Well done as always.
Rock and roll, baby.